How is the outbreak impacting outpatient pediatric or family medicine practices?
You know, like like everything about this outbreak, everything is different. Our practice at the University of Florida, like all the practices that my colleagues have told me have happened for them, we've almost all exclusively changed to telemedicine visits. We still do have in-person visits when indicated, but the majority of our work has gone from being extremely hands-on and face-to-face in exam rooms with families to doing that through Zoom and other applications, so that we can see children and families, but reassure them by distancing. We still do see families in our clinics. We see children who need to be evaluated if they're sick. And we also, following the American Academy of Pediatrics guidelines, we are still doing select well child exams, well child checks, because it's really important that children are still monitored for their growth and development, and that they still receive the needed screening and vaccines against other diseases, because with the healthcare system being so stressed, the last thing we want to do is inadvertently cause other illnesses to rise as we try to protect against COVID.
Okay, thank you for that. And now follows up nicely to your response. How is the use of telehealth and sort of this rapid onset of necessity to use telehealth been different for pediatricians compared to other fields?
It's different, but it's also very much the same. I think we're getting used to this platform pretty quickly. I grew up in the age of the Jetsons, and it was unheard of to think that you'd be watching somebody on TV and having a conversation, but that's our reality now. I think my colleagues and I have gotten very used to assessing children fairly well through telemedicine. I also work with trainees, with residents who are early adopters. They're uniformly enjoying this experience, knowing that they need to be distanced, but still can really connect with families. I actually think this will have a long-lasting legacy. I'm not the only one to think this way, that there will be a major change in medicine, even when this outbreak has settled and we really understand how to protect against COVID. I think telemedicine is here to stay. I think it'll have a very important role in certain populations, families that sometimes it's hard to get out of the house if you have a lot of children and maybe you don't have transportation, but maybe you do have a smartphone. So we can have interval visits, not replacing the important face-to-face time that you can have with families, but you can still create that really important doctor-patient relationship with telemedicine.
And I think I'm a specialist, a subspecialist, and I think we're really finding, we had some families that would have to drive 5 hours from the panhandle of Florida to get here to see us. And we're finding that they really appreciate the ability to not have to drive those 5 hours here and 5 hours back. So I think we won't go back to our old ways. I think we were seeing almost primarily kids in person, and I don't think I think when we can see kids by telemedicine, we'll be doing that in the future.